Welcome to On the Beat, everyone. I'm Troy Thompson. I'm joined today by David Johnson and Richard Duggin of Community Counselling Services. And today we'll be talking all about Crisis Stabilization Unit Services, or CSU. Welcome to the show, both of you. Nice to see you. What is the CSU, for everyone at home who doesn't know what it is?
The CSU, or the Crisis Stabilization Unit, is a short-term facility for us to be able to provide services to individuals who are in crisis. They're experiencing a mental health crisis.
Okay, so when you say mental health, I want to be a little bit clear on this if I can, and either one of you can jump in and answer. When you say mental crisis, what do you consider a mental crisis?
That someone is in danger of hurting themselves or someone else.
Right. And so how does someone get involved, or how do they access the CSU?
An individual can come on a voluntary basis.
Right.
Perhaps family calls, or if necessary, an individual can come via Chancery Court through court commitment.
Okay, so how does someone enter it though voluntarily? Because that's an important part, because if you have acknowledged that maybe you do have an issue and you want to voluntarily submit to CSU.
They would call the CSU and speak to David or one of his clinical folks over there, and set up a time for them to come in, or talk to a family member about bringing them over there, and then we'll do an assessment when they come. And if it appears that they meet the criteria of being a danger to themselves or somebody else, then they'll continue that process on admitting them to the CSU.
Okay, and I wanted to ask you, when someone is self-admitted and they go through the process, what is that process? Let's talk about that for a moment.
Well, our average length of stay is about 12 days.
Right.
Initially, there's a host of assessments: nursing assessment, psychiatric assessment. We have lab work done. We have a medical evaluation done. And then that person is ready for their stay for group and individual therapy, and other services such as recreational and psychoeducational services.
So is this in-house? Do they stay there?
Yes.
For the full 12 days if need be?
Yes.
What happens if it's a little bit more of an issue and they need something after the 12 days?
Well, typically every day or every week, the doctor or the psychiatrist will meet with them and talk, and they'll have a conversation, a team meeting about, okay, for instance, is David ready to go home at day 6 or 7? And if that's the case, then they'll discharge the person, that soon, with medications, with follow-up. But if it has to go past 12 days, then it's also a decision that's talked about with the team and the individual's family, but that they will have to stay longer.
So there is a possibility, if the case is a little bit more involved than what was initially assessed with.
Yes.
Yes.
Right. How does someone pay for these services? Is it part of insurance, or is it out of pocket?
Well, Medicaid will pay.
Oh, really?
And if an individual does not have Medicaid, then they can be covered through a grant.
And when you say grant, that's you guys organising the grant, not the individual or the family, correct?
It's not the individual or the family.
Okay, so after someone has been released, what's the follow-up like? How does that all work?
A couple of days before they're discharged, we'll contact the family and other people that the person wants us to contact for the follow-up care. We'll have somebody from our local office there, and we'll set up an appointment for them to see the psychiatrist at the office. If they need further therapy, that'll be set up. If they need case management services, then they'll set that up as well.
So there's quite a bit of aftercare if need be. You're not just, you've done your 12 days, see you later.
Right.
That's the important thing. That's what I was trying to get to. Thank you so much. We really appreciate both of you. If you want to find out more information, there it all is up on the screen for you. I've been chatting away with David Johnson and Richard Duggin. Back after this short break.